Hello and welcome. Today we're diving deep into a rare and often visually debilitating eye condition called keratoglobus. We'll explore what causes it, how it affects the eye, how it's diagnosed and treated, and what the future holds for those living with this condition. Keratoglobus is typically a congenital condition, meaning individuals are born with it. In most cases, it arises spontaneously, with no clear hereditary pattern. However, there have been documented instances of familial occurrence, suggesting a possible genetic component in some individuals. It can also be associated with systemic connective tissue disorders such as Ehlers-Danlos syndrome, Leber congenital amaurosis, and blue rubber bleb-Nevis syndrome. The underlying cause often remains unknown, making research into the specific genetic factors involved an ongoing effort. Now, let's talk about what actually happens to the eye in keratoglobus. Normally, the cornea, the clear front part of your eye, has a relatively uniform curvature. In keratoglobus, however, the entire cornea thins drastically, especially at its periphery. This thinning causes the cornea to bulge outward into a nearly spherical shape, hence the name keratoglobus, meaning globular cornea. The altered shape significantly disrupts the way light focuses on the retina, leading to severe visual impairment. The extreme thinning also makes the cornea exceptionally fragile and susceptible to rupture from even minor trauma. Keratoglobus is considered a rare condition. Precise epidemiological data is limited, but it's estimated to affect a very small percentage of the population. Due to its rarity and the challenges in diagnosis, the exact prevalence and incidence may be underestimated. It appears to affect both sexes equally and has no known predilection for any specific racial or ethnic group. Studies are ongoing to better understand the distribution and risk factors associated with this condition globally. The signs and symptoms of keratoglobus can vary in severity, but they typically include a marked reduction in visual acuity. Patients often experience significant blurry vision, distortion of images, and increased sensitivity to light, known as photophobia. Due to the irregular shape of the cornea, they can develop high degrees of nearsightedness and astigmatism. A key feature is the rounded or globular appearance of the cornea, which can be observed during a clinical examination. In advanced stages, even minimal trauma can cause corneal rupture, leading to sudden pain and further vision loss. Diagnosing keratoglobus involves a comprehensive eye examination. A thorough history and assessment of visual acuity are essential. The most important diagnostic tool is corneal topography, which maps the curvature and thickness of the cornea. This allows the doctor to visualize the characteristic thinning and bulging. Other diagnostic techniques include slit lamp biomicroscopy to examine the structure of the cornea and pachymetry to precisely measure corneal thickness. These tests help differentiate keratoglobus from other corneal ectasias, such as keratoconus. While there aren't distinct types of keratoglobus in the same way as, say, keratoconus, the condition can vary in severity, ranging from mild corneal thinning with relatively good vision to severe thinning with a high risk of rupture. The presence or absence of associated systemic conditions also influences the clinical presentation. Treatment for keratoglobus is focused on improving vision and protecting the cornea from injury. Initially, corrective lenses, such as glasses or specialized contact lenses, can be used to manage the refractive error. However, as the condition progresses, these may become ineffective. Scleral lenses, which vault over the cornea and rest on the sclera, or white part of the eye, often provide better visual correction and corneal protection. In severe cases, surgical intervention may be necessary. Corneal transplantation, either a full, thickness-penetrating keratoplasty or a partial, thickness lamellar keratoplasty, can be considered to restore corneal integrity and improve vision. However, these procedures carry increased risks due to the thinness and fragility of the cornea. Newer surgical techniques, such as deep anterior lamellar keratoplasty, or DEL-K, may offer a safer alternative. In some cases, particularly with the risk of a rupture, a corneal cross-linking procedure might be considered to increase the strength of the cornea but is still in experimental phases. Since keratoglobus is usually congenital, there's no known way to prevent its occurrence. However, individuals diagnosed with keratoglobus should take extra precautions to protect their eyes from trauma. This includes wearing protective eyewear during sports or activities with a risk of eye injury, and avoiding any rubbing or pressure on the eyes. Genetic counseling may be considered for families with a history of keratoglobus, although the understanding of the genetic basis is still evolving. The prognosis for individuals with keratoglobus depends on the severity of the condition and the effectiveness of treatment. With appropriate management, including corrective lenses and careful monitoring, many patients can maintain functional vision. However, the risk of corneal rupture remains a significant concern. Recent research has focused on developing new surgical techniques and materials that can provide stronger and more durable corneal support. Furthermore, studies are investigating the underlying genetic mechanisms of keratoglobus, which could lead to more targeted therapies in the future. Gene therapy and regenerative medicine hold potential for restoring corneal structure and function. While keratoglobus presents unique challenges, ongoing research offers hope for improved outcomes and quality of life for those affected.